Welcome everybody to the pre-event activity for Virtual Network 4. Before coming into this discussion, we've all gone through a digital activity around designing a vase of flowers. So I'm going to share now my screen with a reminder of what that activity was. And I'm just going to ask everyone to share what were their experiences of doing this and what kind of reflections did they have, particularly in relation to how these tools or these ways of working could be applied to public health care work in Nigeria. So the first step of the activity was around framing the problem. So this was very much around challenging assumptions and working out the right questions to ask to enable design work or new ideas to come through. So we started with part A, was sketching an idea for a new type of vase. And then part B was starting again, only this time looking at a new way to display flowers in your home. So I'm curious, those who did each part A and part B, what was the difference between these two? How did this different questioning or this different framing affect the way that you designed a solution?
Sorry, it's me again. From me on A, I was just focused on the object, on the product. Mm-hmm. But then when I changed at B, it was not, I was not thinking about a base, I was thinking about the flowers and how to make it around the flowers. And then I completely forgot about the base.
Sure. Anyone like to add to that?
Yeah, I think I had a similar experience where for the vase, it was different shapes and forms of that base vase inside which you put flowers. Whereas a way to display flowers, I started thinking of what if flowers could be like Christmas lights, like you have them on a string and you're hanging them up, and looking at different ways of just showing them off rather than putting them in a container. So it was a very different approach.
So it was less constrained for you. You were able to think about maybe a broader range of ideas than in part A.
Yep.
Yeah, exactly. Because even in my case, I was thinking, well, maybe I don't need the flowers at home. Maybe I can look through the window. Or I can have a picture, or I can, connect my camera showing some flowers from the flower shop. Or it's kind of opening completely new possibilities.
Yeah. Did anyone else come up with something quite different for part B compared to part A?
Well, similar way, like the others were pointing out, that it gives you a little bit more kind of a way to think what that would be in terms of like, I don't know, displaying a flower is not anymore like that traditional way of putting flower in a vase and having it somewhere, but to think of like.
Yeah. Great. So we know that applies with this particular challenge, but can you see any parallels between this framing that we've done for the vase and something that you might see in your work in healthcare or in other spaces? Have you seen any kind of similar issues where maybe that question has been quite constraining and has prevented some of these other ideas coming through? That's a slightly trickier question. Can you see ways that you could apply this lesson on framing to work that you're doing in healthcare? Destiny?
Thank you. Good morning, everyone. Apologies for my late arrival. I think a classic example is that usually in terms of program design, sometimes we get really caught up on a particular intervention or mode of solving for a solution, right? And I think that limits us, right? So I'll give an example. in terms of trying to improve, awareness and uptake of immunization, we tend to probably focus a lot on traditional means of communication, right? Traditional media. So like radio, newspaper, and television. And we've been doing that for so many years, right? But when we're able to remove ourselves from looking at the vehicle or the structure that we're trying to use to address the problem, and really look at the people who are affected by the problem and look at the ecosystem in which they live and their daily, it opens up so many opportunities to address the issue, right? It helps you to look at how can we solve for improving their awareness around immunization in a different way, right? So maybe like, for example, we realize, okay, well, we don't have to use media. We don't have to use these traditional channels. And we see that when you're using this approach and it's human-centered, that people in different contexts are going to have different types of solutions that are going to meet their needs. I think that's what's really helpful about focusing on the person or the subject itself to probably get a more appealing and more palatable kind of solution that will sit well with the person that's supposed to be a beneficiary of the public health intervention. So. Over.
That's a great point. Thank you, Destiny. Yes. Any other reflections on this reframing activity that we did and about ways to apply it in our healthcare work? So we'll probably come back to some aspects of that. I'll just move on now to part B of the activity, and I'll share screen again as a reminder of what that was. So after we did the framing the problem, we moved on to section 2, which was about pushing ideas further. And for those who came to the Fostering Innovation session that we did for the virtual network a few weeks ago, this will be familiar as an example of a creative tool that can be used to perhaps expand the number of ideas or the number of possibilities that we're able to come up with. So the tool that we used in this case was Reversal. And Reversal tool is something that is often very useful at the beginning of coming up with ideas when it's a struggle, when you feel like these are all ideas that we've had before, or this is something that sort of seems obvious and you can't come up with anything new. Actually trying to think of the opposite so trying to create more problems and do things worse can actually be easier. And it feels very silly when you're doing it. It feels, maybe you're actively fighting against your own objectives. And sometimes that means that actually you end up laughing and having fun with it. But that fun is productive because very often when you do this exercise, it kind of leads you into then thinking, okay, we've made this awful, let's reverse that and think about what the opposite, the good possibilities are, and somehow that brings new ideas that you wouldn't have thought of in the first place. So it's a good thing to get out of a rut. The examples that we gave here from a reversal tool are from the Uncomfortable project. And we have here the fork. How can we make it harder to eat food? We have the uncomfortable key, so it can be entered into the lock, but it can't be turned. And then another example of a lock, which perhaps is a little more complicated than it should be. So these things are funny, but by how to make it worse, sometimes you actually think about how to make it better. So we went through an activity on that basis of thinking about, from the design that you did in part 1, what are the things that are making it useful, and then how could you reverse those and make them worse? So I'm very curious to hear, those who did this activity, how did you find it in general? And what did it do, if anything? Is there any way in which it did help you with your design? So how did you feel going through that reversal tool?
Well, I started to do it, but I don't know where it kind of led me, because I took the vase, I turned it upside down, I squeezed the flowers in, and I couldn't see anything anymore. And it didn't hold water because it was upside down. So it kind of made me think of this, but it felt that it's hard to apply in my context.
Sure. Anyone else have a similar experience to that?
Yeah, for me, it was also a struggle, even like breaking free of making something functional or that works well. And so, like, for example, like the hold water prompt. And I thought, okay, what if there was a vase with a hole in the bottom? So you never really hold water. It's always like flowing out. Okay, but then how does that apply to what I'm trying to do? And so like that was proving to be a challenge, not just like rethinking the sort of difficult to use kind of design, but also like how it applies.
And you mentioned, I think in part one, that you had this idea of doing like a string or hanging flowers as a string as opposed to in a bunch.
Yep.
Was there anything that the reversal tool helped with that string idea?
I didn't think about that actually.
That's all right. I'm not going to put you on the spot. Anyone else have some reflections on that activity? So how about, I realized that we've heard a couple of concerns about maybe how to apply this in healthcare work. Perhaps rather than, the reversal tool itself is one of a whole suite of creative tools. So things where you end up sort of playing with your ideas a little bit and trying to come up with a broader range of possibilities. Can you see maybe ways for creative tools in general to be applied in this healthcare space?
Well, sorry again, it's me, but thinking about the reverse tool, for example, it comes to my mind, and I will think about that it's probably not the same, but for example, so many times when I've been working on designing a new product or service, we started collecting all the complaints from the users or from all the different professionals around the service or product. And for me, it's kind of related, it's kind of, okay, what's not working? And it's a kind of way of thinking on the worst. And then if you think about the worst, then it's easy to start to see, okay, where you have opportunities to improve or even to change or to innovate.
Yeah, I think taking it back to more of a service context, maybe. I've seen an example before that's like looking at the public transport system. If you have a public transport system that's overcrowded, then you say, how can we make that worse? And so it's quite easy to think, well, if we want to make it more overcrowded, we need to run smaller buses. We need to run them less frequently. We need to make sure they're all at the peak time and that everybody has to start work at exactly the same time. And those kind of things, then when you reverse them, it's really obvious. Like, okay, well, then if we want to make it less crowded, we just need to make bigger buses and run them more frequently and stagger the times that people are starting their work and things like that. So it could be that you get to those final ideas on your own, but something like this can help to actually accelerate that process a little bit, or even enhance that process.
Yeah, and for example, on that point, I remember, I think probably it was 10 years ago, I did a project for a hospital in Spain, and it was about kidney surgery, all the process. And we work a little bit like that, first it was, okay, let's try to see all the worst things that are happening. And then based on that, it was so easy, as you were pointing, to start to think, okay, how we can avoid that. And then, it was the case to develop a solution that was better. No, for example, I remember that one of the worst things, it was the waiting time when there is the patient, there, and the caregivers, the family, it's waiting at the waiting room, having news from the surgery, and and then it was so easy, just giving them some kind of idea about the time, saying, look, in before 12 you will be meeting the doctor, and and then it was a good way, for example, to low down the stress. And
Great, thank you for sharing that. Anyone else have some thoughts about these creativity tools, and perhaps how to apply them in our everyday work? Are there perhaps some times when stages of work that are more appropriate for creativity tools, and maybe some that it would be less appropriate for?
Yeah, thanks. I think just thinking about it again, right? The idea of the reversal tool. Just thinking about the most common problem that we do solve in the healthcare space, which is reducing stock out of essential commodities and other technologies in the health facilities, right? So maybe while solving those kind of problems, one can start by saying, okay, so if the stock out of a particular commodities or a particular technology, say vaccine, is a single digit, so maybe we can start by saying, okay, so how do we worsen the stock situation, right? Maybe we can say things like, okay, so we first of all delay the delivery cycles. We don't really supply frequently. We don't forecast properly. So just like kind of identifying all of those. So if they can be reversed, meaning we can potentially solve the issues as such. So just my reflection around that. Thanks.
That's a wonderful example. Thank you so much for sharing that. Are there any other points? Otherwise, I'll move on to section 3. Okay, so the third and final part of the activity was around designing for the user. And I think this is very much what we would assume, that human-centered design has a very important component. So in this activity, we took the same design that we've been working on for holding or displaying flowers, and we chose a persona, a short description of somebody who might be using that, and then adapted the design for their purposes. I'd love to know if anybody chose Ayinka and Charles. So this was the busy family with young children. Did anybody do a design for this particular profile? You can either unmute or raise a hand to say yes.
Yeah, I was thinking about that.
Great.
And, yeah.
So what were the kind of adaptations that you made to your design after reading this description?
Well, my vase has like 2 parts. One is that when the flower is fresh, the vase is high up and basically is out of reach of the children's hands, but also like takes a little bit more attention because it's there elevated and more visible. And then underneath that, there is this plate which actually collects all the kind of what are the flower kind of leaves when it starts to dry out and get because we are busy, we can't kind of keep it live that long necessarily, or then they tend to die. And they fall down on that plate, and then actually on that plate they keep on looking still quite nice and live, and then actually children can take them and play with them and maybe do something about them.
Well, that sounds really wonderful. I would love to see that design.
Yeah.
There was a second person. I didn't see who it was. Sorry, who else?
It was me.
Profile? Oh, hi.
So I went with, because I had the string flowers, idea. One of the considerations I had was like Nico about what happens to all the petals and things that fall off. And so I was thinking also in terms of like easy disposal, because busy family means they don't want to go cleaning something separate. So I thought, what if there could be like a transparent cover for the flowers? So if there's petals that fall off, they fall within that. And then to get rid of it, it's just like a matter of taking that one whole thing and getting rid of it and replacing it with fresh flowers inside that same cover.
Wonderful. I have to say, these all sound like new ideas. They're not something I've ever seen before. Who did their design for Bunmi, the patient in a hospital ward? Either unmute or hold your hand up. Nobody went for Bunmi? Ah, what a shame. Okay, and how about Obi? Obi is our elderly person with arthritis.
I did for Obi. And
yeah.
maybe because, you know, now I have some relatives that they are facing the same problem, and probably because that. And, you know, when I was thinking about the design, about the first thing I was thinking, it was in terms of usability, how to handle this. Because, of course, if she have problems, you know, with the arthritis, and I was thinking about the size, that it's important. And then also how, you know, thinking about a good grip, how to make, you know, easy to move or to handle. And also I was thinking that probably would be good to have some kind of comfortable handles to make it easier to carry and to empty or to. And then I start to think a little bit about materials. What type of materials? Because glass, I'm not sure it would be a good option. Or maybe yes, but maybe then I was thinking maybe I will need to put some kind of silicone or kind of material that it helps more on the good grip, maybe on the handles. And yeah, that was kind of my thinking behind the design.
Thank you. So then everybody who went through this, and if anybody hasn't spoken up yet, please do. I would love to hear from you as well. But everybody who went through this part 3, then designing for the user, it sounds from your descriptions as though you know, this wasn't just a tailoring thing, that it actually inspired you to think about new features and new ways of producing this design. Is that fair to say? Did anyone have that experience?
Yes.
Yeah. Do you have any other reflections, like what went through your mind, or how did you feel like your design benefited from designing for the user, from having this understanding of who the person was using your product?
Well, I think it's a good way to put in yourself in their shoes, you know, and to try to understand what's the problem that they have, what they are looking for. And yeah.
For me, it was like when you have these different types of people and their needs, you actually start to think about different variety of solutions. And with those, you can move your thinking forward, and maybe that kind of helps to find one new solution or a couple of alternatives and so on. So helps you to build a variety of solutions also.
And then, you know, from my side, also another reflection, it's that, you know, when I was comparing the 3 users, in the second one, we have a context, a specific context, more explicit, hospital. And in this case, also I was thinking that, oh, wow, you know, then if she's in a hospital, I have to think not only on herself, but also I have to think about, you know, what it means to have flowers in a hospital. And what are the implications? And also there are other users there, you know, there are the nurses, the doctors, all the cleaning staff coming. And then it was kind of, okay, wow, then it's a little bit more complicated. I'm not designing only for her, you know, I'm designing also for others, no? And I would say on that, for me also, it was a good point that, you know, you were not just focusing on the user, but in the whole context. And also, I think that the fact that it's an hospital, also, it gives you another type of challenge.
Yeah, that's a really great point. I think in the hospital, you also have to think about, well, who are the staff working in that ward, right? And is there a cleaner who then has to be responsible for taking care of dead flowers or cleaning the surfaces? And who else is going to be sharing the same space? Yeah, there's a lot to think about. Wonderful. Thank you. So this activity then, I think it's fair to say, very deliberately, it's a simple product and a simple process that we've gone through, far simpler than we would expect any of our public health work to be. And it's not a complete process, right? We've gone through these 3 example tools. So I'm really curious to hear from you, what was missing in that process in order to go through a design solution for something like public health. What else would you want to go through? And I think there's a raised hand. Oh, it's disappeared again. Sorry, did somebody have their hand up?
No, yeah, it was, hi everyone.
Hello.
Yes, it was on, the different users, but it was already been, touched. I just wanted to mention that actually focus on the user, not the environment, the context. Or like someone, the previous, interlocutor was saying, it's also important to take care of what, surrounds, the users and how it can affect other people, for instance, in the hospital. Me, I was more focused on the needs of, of the end user. For instance, when in the busy family, we need to take into consideration all those children, who can be, to put all the waste out of reach, and then the patient in the hospital needs some hope, some hope. So we need something more attractive in terms of flower, and give her the person, a kind of hope that, okay, soon you will be fine and you will definitely leave the hospital. And for the elderly person, of course, something which will not give much work, like the vase who can hold water, and with less activities in terms of, putting on some water, all those stuff. So those are the things I was actually looking at. Thank
Absolutely.
you.
Yeah, those are really, really great points. And yeah, thinking about some of the more emotional aspects of it as well, the fact that this hospital patient, perhaps she's actually spending a lot more time looking at it than some of the other profiles, and as you say, getting hope from it, having this emotional attachment. And that does lead very nicely, I think, into this next question about what else we should be doing in order to design effectively. What else should be in this process? What's missing that we haven't done in this very simplified version of it?
Can I go on?
Yeah, please.
I also think that it's we call communication for development. Usually the solution can come from the users, the solution can come from the community, and decide what is necessary for them in order to to solve a problem. So a problem they are facing, in the day-to-day life. So I think even in solving problems, in getting solutions, we need to put a lot of key stakeholders in solving, in designing some solution to address whatever they are facing, whatever is actually hindering, some outcomes in the community. Just an example.
Mm-hmm. That's great, thank you. Any other thoughts? What else should we be including in our design processes? I think we had this, part one was about framing. We had one creative tool, and then we had a persona that we were designing for. And then of course we've now expanded on that to also look at much more detail on that user's perspective, but also the other stakeholders and the context in which they're sitting. Anything else that we could be doing to maybe better understand those things?
I just had a thought to build on what Dr. Landry was saying before. about involving the users and the key stakeholders in designing solutions. So for the vase, one thing we could do, instead of just thinking about them and empathizing with them, we could actually visit a family with children, for example, and bring with us some flowers and maybe some cardboard or other materials to create a vase or create a way to display them, and see what they do with it and see where in their home it could be, and then use that as the inspiration rather than just, imagining on our own. So like pushing it more towards this co-design or participatory design approach.
That's a really, really great point. Yeah, we've started to think about who these people are and their context, and perhaps visiting that would help us to understand it better. But yeah, the next stage could be to, just try something out, give them some materials to play with, see, perhaps there are things that they themselves don't know about their own needs. So what kind of tools or what kind of processes or approaches could we start to apply more in public health work immediately? Like what can we take from this discussion and start applying in this work? And what are maybe some of the barriers to us doing that? We could think about things like hierarchy and what people's expectations are of the work we're doing. Is there any conflict maybe between those expectations and the sort of approach that we've been discussing that we think could be effective? If there is some conflict, what can we do to help manage that? How can we perhaps persuade upwards to the people holding the budget and persuade them that this is an appropriate way of working?
Yeah, thanks. Thanks, Ross. I think for me, it's majorly using evidence to convince the decision makers, right? Just clearly explaining the benefit, right? Which is more like a cost benefits analysis, right? So showing clearly how other approaches have failed and how potentially this approach of putting the end users in the picture even before designing the solutions may potentially work. I think if that can be well articulated, I think that may be the best way to go about it.
Mm-hmm. Yeah. Thank you. Any other thoughts, Destiny?
Thank you. And just writing on Mirima's point about conducting a cost benefit analysis, it may be useful even if we don't have tangible examples within like our context of seeing that proof of concept from other maybe LMICs or other like geographies that are close or similar to the one that we're trying to look at, just to drive it home and make it more practical, right? So they're able to appreciate, what this may bring forward.
Great point. Thank you. Nneka?
Yeah, hi Rose. Thank you. Thank you very much. And yeah, just riding on what Destiny and Yerima had said, really, if at the start you have the end users pulled in at the design phase, then when you're implementing, it's easy to show them, oh, look at the solutions that we came up with and how easy it is to implement, and it's even more cost effective. Case in point, what came to mind for me was for one of the programs that I'm working on, where we had to do training of healthcare workers. And then after the training, we transitioned it into like a peer-led mentoring, where we had the more experienced healthcare workers mentoring their peers at the health facility. And we're able to sell that to the government and show them that this was a practical way of building the capacity of the healthcare workers on a routine basis, and it was also very cost effective because they were not spending costs to pull them to a classroom for didactic training. But because they were all part of the process and even just developing the plan, it was easy to come back to them and say, look at the difference in cost if you were going to do a classroom training repeatedly, as opposed to just training them on the job and having them schedule routine, like refresher mentoring. So yeah, just basically buttressing, like just showing them the cost effectiveness, because when you engage a lot with the state government, there's always that conversation that comes up about having limited funds and knowing areas to prioritize. So
Mm-hmm. Yes, of course, those are key concerns, and we certainly have some case examples. I know that you have some case examples. We'll also hear from two of them at the virtual network session next week. So next Thursday, the 15th, we're going to hear two case studies from organizations that have exactly taken this approach and can confirm the cost effectiveness as well as the solution effectiveness that has resulted from that. Speaking of which, we have a few minutes left from this call. We do have, so next week we'll have some people who have gone through this experience and will be presenting their case studies. We'll also be speaking on a discussion panel around this topic and about specifically how we can apply the human-centered design approaches to public health work in Nigeria. Do we have, like, I think there's been a lot of agreement on this call. I've heard a lot of kind of lessons taken and ideas for how we can expand on those. Do we have any questions that we would still like to put to that discussion panel, or anything that maybe is still a little bit unclear, or anything that we'd like them to expand upon? Destiny, is that your hand raised?
Oh, apologies. It's from my last
It's
contribution.
from the previous one.
Sorry about that.
Nneka, I think yours is though.
yes, thank you, Rose. And this is a conversation that internally the team, the CHAI team, has been having. But really, for the participants that we have and that will be joining the call, we need to show them how practical and how easy it is to implement HCD in their daily routine activities. So that's, I think, will be like something that we should really discuss with them, because they go, oh, HCD is not really very cost effective. We have to have all these meetings where we pull people in. We have to go out to the field. We have to prototype. And sometimes this process can take upwards of 4 to 5 months. But most times donors don't even give us that leeway. They tell us to implement a project in 2 months. We can't spend 1 year doing HCD. So what's the practical way that we can quickly implement HCD and see like the improvement in the services that we're providing? So I know that is something that will probably come, like a lot of people want to know that, like, okay, I'm working maybe in the malaria space. How do I implement HCD in an easy way? So it's something that I think we should really think about.
That is a great topic for us to pick up next week. Thank you for that. Anyone else keen to hear about that or similar issues? Please feel free to expand. Does anyone have another topic or another question that they would like to put to next week's discussion panel? Okay, so we're almost at 11 o'clock, which means I think we should probably wrap up around here. I hope that everybody will be able to rejoin us next week for the Virtual Network 4 event. If you haven't already registered for that, please go ahead and do so. As I say, we will hear those 2 case studies and we will have the discussion panel. Any questions that you think of between now and then, we will ask you to please post those into the Zoom chat during that session. So you can do so as soon as you join next week. please type in your questions and we'll make sure the discussion panel also covers those. In the meantime, thank you so much. Thank you everybody who has taken time out today to join this discussion and also to complete that activity. I hope that it was enjoyable as well as informative, and I look forward to seeing you again next week. Thank you.
Thank you, Rose.
Thank you,
Yeah.
Rose. Everyone.
Thank you, Rose. Bye,
Bye.
everyone.
Thank you.
Thanks,
Bye.
Rose.
Thanks,
Bye-bye.
everyone. Bye-bye.